Congressman Paul, let's go back to our callers again. The exchange number is 1-800-892-6477. And our guest today, Republican presidential candidate Ron Paul. He's a Texas congressman. He ran as a Libertarian candidate for president back in '88. He joins us in studio this morning, and you can chime in too. 1-800-892-6477 to Andover, and Jen is on the air. Hi, Jen. Go ahead.
Hi, Dr. Paul. I have a question and a comment. My comment very quickly is to say thank you for running. I am tired of politicians telling me one thing and voting another way, and I can see from your record that you are truly a man of your word. My question to you today is the Democrats are talking much about health care, and their answer to health care is socialized medicine. What would your answer be?
Thanks, Jen, for the question.
Well, I think you're absolutely right. We have a mess, and the Democrats now say we have to have socialism. Socialism doesn't work. I mean, anybody who advocates socialism, I think, they're going in the wrong direction. We've had a form of medicine since the 60s, and it continues in that direction. It's not socialized medicine, but in a way, it's interventionist type of medicine where the government regulates and controls and spends, and it lends itself more toward a fascist approach because right now, most of the money in medicine ends up in the hands of corporations, the HMOs, the PPOs, and hospital management companies, and Wall Street, and investors, and it ruins the doctor-patient relationship. Because of this, prices go up. So people who are on the margin, who might not have insurance and can't pay for it, they're getting hit with an 8 or 9 or 10% inflation rate in medical care costs. And to me, it's all a consequence of government intervention. The American people have been offered two lousy choices, one which is corporatism, or a fascist type of approach, or socialism. And we deliver a lot of services in this country through the free market. And when you do it through the free market, prices go down. But in medicine, prices go up. Technology doesn't help the cost of medicine. It goes up instead of down. But if you look at almost all other industries that are much freer, technology lowers the prices. Just think of how the price of a cell phone goes down. Poor people have cell phones and televisions and computers. Prices all go down. But in medicine, they go up, and there's a reason for that. And that's because the government's involved with it. So I would say the most important thing we can do is turn back this trend towards socialism and socialized and government control and allow people to opt out of the system. Let them get out and give them a tax credit and let them have their hospital, the medical savings account where they get all their money back off their taxes, and they're in control. And they would have to pay all their bills.
And we could do hours and hours of programming on this topic. So I'm only going to ask you one follow-up here. Are you saying if there were no government involved, the price would go down? Because the fear is if there were no government involved, the price would get even higher and people wouldn't be able to afford medicine.
Yes, I do, but a lot more than probably what you're thinking about. Because you have to have competition in the delivery of care. For instance, if you have a sore throat and you have to come see me, you have to wait in the waiting room and then get checked and then get a prescription and go, and it ends up costing you $100. If you had true competition, you should be able to go to a nurse who could, for 1/10 the cost and very rapidly do it, and let her give you a prescription for penicillin. See, the doctors in the medical profession have monopolized, the system through licensing. So, and that's not an accident because they like the idea that you have to go see the physician and pay the huge price. And patients can sort this out. I mean, they're not going to go to the nurse if they need brain surgery. They can go there for a sore throat or
let's say that I'm poor and you're not. That means that you can afford, to get your cancer checked out early, and I might hold off waiting because I can't afford it.
And what you need to do is just
the idea is that right. When it comes to health, it's not a pure raw economic issue. It's your body. It's your life.
It really can be. It really can be. Just look at everything before 1965. I mean, how many people can you get me any pictures of people just dying in the streets because they didn't get any medical care? No, there was more wealth. The country is wealthier. There's more generosities. The churches would be running the hospitals. Now, everything is the maximum cost. You come to the emergency room now, and especially because of the litigation involved, doctors have to overorder. And if you're not on the government system, you're put on and you're charged the maximum. When I was working at the Santa Rosa Hospital, the minimum was charged. And if you didn't have any money, you weren't charged at all. And there's nothing wrong with that. People are frightened about freedom, and there's no reason to be frightened about it. It really works. It has worked for many, many years. And we've only had the real test of freedom in this country for a short period of time when you look at all of history. But most of the world has been run by totalitarians, control and central government and socialist ideas. And I just have a much more confidence that free people are capable of taking care of themselves, and that government bureaucracies don't work. Central economic planning doesn't work.
Let me jump in here, and I think we'll have to follow up on more of the free market and when it works and when it might not at another interview. We've got lots of people waiting on the line who want to talk to you. Jen, thanks for that healthcare question. Jim is calling from Stafford. Hi, Jim. Go ahead.
Yeah, hi, Dr. Paul. I just wanted to say thanks for your stance on anti-intervention on foreign policy, because I've spent 17 years in the military and suffered through Clinton's interventionist foreign policy.
Wow, thanks.
I'm in the Air Force.
Mm-hmm.
My question is, do you believe that Congress should have to read the bills that they pass? In other words, I don't know if you've seen the Read the Bills Act. Do you support that legislation?
Yes, I do, and I've introduced legislation that was very similar, but I support that legislation. I think they should read it, and they should sign that they've read it, and that they understand it, and they know how they're going to finance it, and they should justify it by the Constitution. But certainly the Patriot Act would have never been passed because it wasn't available to us. A very, very complex piece of legislation. It was almost 400 pages long. It became available less than an hour before it was debated on the House floor.
Really?
And everybody,
an hour before it was debated on the House floor?
Everybody was panicked. The people want us to do something. This is the terrible thing about, when people become frightened. And this is why governments and officials always want to pump out the fear. Well, you got to do something. But these Patriot Act, that type of bill, was available even before 9/11. They saw this as an opportunity. But the congressmen were intimidated. If I do nothing, my people are going to be mad because they want us to do something. And people are frightened. When they are frightened, they're much more willing to give up their liberties. But giving up their liberties won't make them safer. That's the real sad part of it.
Democrats say that President Bush has become a chief fearmonger and that Dick Cheney is a chief fearmonger. Again, this is what Democrats say, that they have frightened people so that they can stay in power. How do you feel about that criticism of the Bush administration?
I think there's a lot of fear-mongering going on all around, whether it's on foreign policy or domestic policy. Just think about, just recently there's another possible terrorist attack. These people they arrested. I think that's the 11th time. I don't think anybody's ever been prosecuted. And these people ended up, they had no money and no explosives. I mean, I don't think you should ignore that, but it ought to be put in perspective.
You're talking about the most recent case at the airport.
Yeah, and we should deal with it, but it shouldn't be used to further invade our privacies. And that's what they do. Anytime they can stir up the fear, whether it's international, that they're going to hit us with a nuclear weapon. People, we have to do something, and people are easily intimidated. I think that most government officials over the past several decades have overdone the use of fear to scare the American people into giving up their liberties. I think it's a dangerous trend.
So it's been a bipartisan tactic,
I think so, and I think it's also done in economic policy too. If you don't have the government, everything is going to go to pot. So therefore, we have to have. What would happen if you didn't have FEMA? Could we take care of our floods and our hurricanes? Oh, think of this, yeah, probably could. FEMA gets in the way sometimes.
Let's